My major reason for being here is I'm very concerned about what my health insurance will be like in the future, why the government feels the need to rush this project through like they've been rushing through so many others. I have very good health coverage now. I fought hard to get it. I negotiated with my insurance company, had all the waivers removed that were on there. I have pre-existing condition, and my pre-existing condition is now covered thanks to negotiations that I did with my insurance company. And I'm very concerned that the government is going to try and put me into some project, some pool of people, and they'll then try and not cover my condition because it's a very costly situation for me. I've had more than 60 operations, and it's very scary, isn't it? And I'm afraid that they're going to, eventually say, we are not going to cover you, we're not going to do anything because you are not worth doing anything for, you're too costly, we're just going to put you out to pasture. I have a 97-year-old grandmother and a 72-year-old mother, and my grandmother has Alzheimer's, and at her age, are they going to cover her? Are they going to do anything for her? Or are they going to let her rot on the vine? So I'm very concerned about this. And there are not the numbers that he says that are uninsured. I know that for a fact. I know a lot of people who choose not to be insured, and those are the numbers he's counting. My brother's one of them. He chooses not to be insured. A friend of mine is another one of those. He chooses not to be insured. He's got the money to pay for whatever he needs. So these are the types of people that they're talking about who are, quote, uninsured. They've made that choice not to be insured. That's their choice. There's no reason that we need this plan shoved through so quickly.
What brought you out to the rally today?
To protest our Congress and our government. I think they're going way too far. They just want to take over everything. People don't have responsibilities anymore. The government will take care of you, and that's not the way. That's not an American way.
I work for a durable medical equipment company, and the Health Care Reform Act has parts of it that could affect our industry. They're actually requesting for an additional reduction in our reimbursement. By having that reduction, in addition to first of the year we had a reduction from Medicare, our company took about a 26% hit in our reimbursement. If this goes into effect, it could virtually put companies like ours out of business. The trickle-down effect will be that our parents, our grandparents, are not going to be able to have oxygen in their homes. They're not going to be able to have wheelchairs provided to them.
And I'm here because I'm so concerned about the intrusion that this plan will make into the private lives of citizens, and particularly their health care, and particularly seniors. It seems that seniors are going to bear the brunt of paying for this bill by loss of care.
I want the Obama administration and Congress to keep their hands off our health care.
We're here at the rally because we oppose the proposed legislation of this health care reform. Congress hasn't been able to fix Medicare, hasn't been able to fix Social Security, and now they're owning part of the auto industry and the banking industry, telling them what to do. I don't like the movement that I see in our country, that it's toward more and more government control. That's not what America's about.
National health care, it's a bad plan, it's a bad idea. It's not going to provide what it promotes, and anything the government does, they do very poorly and at extremely high cost. It's going to be health care rationing. If you're old or real sick, you're done under this plan. It's going to be, they're going to have a national health ID card. They're going to give free health care to everybody, regardless of citizenship. It's just bad policy for the government to take over another portion of the economy, which is what, 7, 8, 9, 10%, depends on the figures you look at. And when the government gets in control of anything, they do a horrible job. We can look at the subsidized housing market for that.
I can give you a lot of other examples that I know from my own personal life about we're going the wrong way. We have personal friends in Europe, in Denmark, and in the UK, and they've got this same kind of socialized medicine there. Well, that too.
And Canada.
And well, that's right. We got some friends in Canada that do the same things. I have some friends in Canada who tell me that they're very worried about us down here now because after you pass this stupid bill, where will we go to get health care? That's what they're saying. I have friends who have died in Denmark while waiting in line to get treated. I have another friend who's now being denied treatment in London. A professor, a man who has contributed greatly to the society in which he lives, and they deem him too old to make a further contribution, and so they're ready for him to die.